Along those lines, say a pharmacist, and I, you know what, let's talk about the antibiotics that are appropriate and how they should be used appropriately. And then we can talk about, okay, if a pharmacist sees one of these, what should they do next? But which antibiotics are recommended and how should pharmacists be evaluating those for, again, for dental indications?
Yeah, I think the kind of red flag that we want to talk about today is definitely clindamycin use, right? For decades, this was the go-to for dental professionals for patients who reported allergies to penicillin or
Mm-hmm.
amoxicillin. And the reasoning made sense at the time because of the good coverage for oral anaerobic bacteria, penetrates bone well, availability and familiarity to clinicians, right? It all made sense. But now we know that clindamycin carries one of the highest risks for C. diff infections. So,
Mm-hmm.
um, despite this growing awareness of these risks, though, clindamycin is still commonly used in dentistry, right? Is it just laziness, right? Not keeping up with literature, habit? I'm not sure,
Mm-hmm.
but we're still
All of those
seeing
things, probably, right?
a lot of it, right? Yeah. I mean, dentists were taught that it was just the
Yeah.
standard for patients who
Yep.
were
Yep.
allergic to penicillin. And penicillin allergies are overreported, right? And not
Yep.
truly allergy tested enough. So, there's some uncertainty about the alternatives, right? Clinicians are just unsure which antibiotic should replace clindamycin, especially if they're not keeping up with the literature. So, what we want to think about, and this is important for pharmacists, I think, to consider, and we'll get into this, but deliver this message to dentists, is that when antibiotics are necessary, clinicians want to choose the narrowest effective spectrum,
Mm-hmm.
avoid high risk agents when alternatives exist. We also want to choose the shortest duration possible. So
Mm-hmm.
the American Dental Association guide recommends reevaluating patients within 3 days and discontinuing antibiotics 24 hours after symptom resolution rather than using long courses.